Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. Based on the prevailing research, I encourage most of my patients who are over the age of 40 to take a supplement each day that contains 500 milligrams of glucosamine sulfate combined with several natural anti-inflammatory agents like quercetin, bromelain, and MSM. So why do I do that? Because after the age of 40, the body makes less glucosamine, and glucosamine is required for cartilage synthesis in your joints. So without glucosamine supplementation, the rate of cartilage breakdown is now faster than the rate at which your body can synthesize cartilage, and so you get cartilage erosion, you get degeneration, it leads to osteoarthritis or degenerative arthritis as you get older. So you want to prevent that. As well, white blood cells that line the inner lining of our joints as we get older secrete more inflammatory chemicals called cytokines that increase pain and further destroy the cartilage and bone. So the use of natural anti-inflammatory agents suppresses that, combined with glucosamine, which prevents joint cartilage erosion and damage, preventing inflammation and joint stiffness and osteoarthritic changes. So I really like that as a preventative strategy. Now, beyond that, some studies have shown that glucosamine sulfate supplementation can actually halt the further destruction of cartilage in patients that already have mild to moderate stages of osteoarthritis and reduce associated joint inflammation. They can move more easily, they get symptomatic relief, but the dosage now has to be 1,500 milligrams a day of glucosamine sulfate. So for patients who already have osteoarthritis, that's mild to moderate stage, I usually recommend a daily dosage of glucosamine sulfate at 1,500 milligrams a day. Now it also helps if you're following an anti-inflammatory diet, meaning you reduce your intake of high-fat meats and high-fat dairy products and foods high in trans fats, deep-fried foods, and you watch your refined sugar intake, stay at your ideal body weight, and you do aerobic exercise. But what about people that have more advanced stages of osteoarthritis or severe cartilage damage or severe tendon problems and acute sports injuries? Well, in these cases, more and more doctors are experimenting with stem cell injections into the joints and or platelet-rich plasma injections, or what we call PLP injections. I'll explain this in a moment. There was an update on the efficacy of these procedures that was just published in Medscape on July 12, 2017. Now, many patients ask me about stem cell injections and PLP injections, often with respect to joint, tendon, and cartilage injuries, so I thought I might share with you what we've learned to date. So with stem cell injections into the affected joint, it really has shown very disappointing results thus far. And it's largely because the cartilage in our joints lack blood supply, and the blood supply is required for the stem cells to really get access to the areas that they need to repair and regenerate. However, there are certain types of joint problems where stem cell injections have shown very impressive results, especially with a condition known as osteochronosis of the hip. And this is where the hip joint, the blood supply into the bone has been cut off or shut down for some reason, and it's extremely painful, and you get bone degeneration and a lot of pain. And stem cell injection in that particular condition has been fairly successful, and that's very encouraging. And they are working on new approaches using stem cell injections that they're being developed now to help improve the ability of the stem cells to repair cartilage damage in arthritis and joint lesions and injuries, but these techniques are not yet refined. What seems to be more effective for these types of conditions at this time anyway is the use of PLP injections. So platelet-rich plasma implies that a doctor takes your whole blood and then puts it in a centrifuge to get rid of the red blood cells. So now the centrifuged blood has a higher concentration of growth factors than whole blood that appear to encourage the healing response with cartilage damage, tendon damage, and certain types of sports injuries. So that gets injected now back into the joint. So in orthopedic applications, human studies have shown that some impressive results in osteoarthritis of the knee, in speeding up also the healing of bone fractures and tendon injuries when you're using this PLP injection technique. Now, all this research is still fairly early stage, but I think it has the potential to be very helpful in select cases. I've seen some patients who have been really helped by the PLP injections, especially if you combine it with other evidence-based rehabilitation therapies that are performed by chiropractors, physiotherapists, athletic therapists, and exercise rehab specialists. Now, PLP injections are also being used in dentistry and in dermatology and anti-aging medicine to actually help promote the regrowth of hair in androgen or male pattern hair loss. In fact, a really important placebo-controlled study was published in 2015 showing impressive results in reversing male pattern hair loss in a well-designed trial, in case that is also of interest to you. So as always, I've provided the scientific references in the text below, so thank you for watching, and I'll see you next time.